Still don't have the details of the age or gender of these deaths, but we will certainly provide them for you later today. And again, our condolences to the friends and the family of these two people who have passed in the last 24 hours. Yesterday we had a total of 3,079 positive cases in South Australia. This is a massive reduction in the day before, and it is certainly well below our 7-day average. Very importantly, yesterday we had 4,046 recovered. So more than 1,000 people recovered over and above the new infections in South Australia. I think this gives us another very clear indication that we are at or around that peak here in South Australia. And I think it gives us some optimism that the settings that we've put in place are reducing those numbers down. I can tell you that 2,257 came from PCR tests and 822 came from the rapid antigen tests. We have had an increase in the number of people hospitalised up to 285, but a reduction in ICU down to 24, and we maintain 5 people on ventilators, which again is the lowest we've seen for quite some time. I have asked Professor Spurrier whether she could do an analysis of the people that are hospitalised, because we haven't broken that up between people that are in hospital with COVID rather than people that are in hospital for COVID. And so we will provide that information for you tomorrow. There are a large number of people who are in hospital with COVID because they've got that infection, but their infection isn't really what has driven them to go into hospital. It's nowhere near the 50% that has been reported in other states, but it is still a significant number that we do need to report. And of course 285 is well within our capacity to service. I can also let you know that our total testing yesterday was 20,515 tests. This was broken up between PCR tests of 13,319, 7,084 collected RAT tests collected from the city, and 112 from Berry Barmera. So what I can demonstrate from that is a significant reduction in those people that are now only using the PCR, and a flip to the rapid antigen test as well. And of course we now know that there are very limited lines across South Australia for a PCR test that is significantly more accurate. If you have any symptoms whatsoever, we're strongly advising that you get the PCR test. Some people have got a rapid antigen test negative result, but they have symptoms. They really do need to go and get that PCR test. It's very available in South Australia, and it means that you could start your quarantine for a positive case much earlier. Very rapid turnaround times for PCR testing in South Australia this week compared to last week, where we had some pretty extreme heat conditions in South Australia. The Port Augusta and the Murray Bridge rapid antigen test collecting sites are now open. They're going to be operating from 8 o'clock in the morning till 6 o'clock at night. The Police Commissioner gave a further update with regards to the smooth operation of those rapid antigen test collection sites in South Australia. That gives him greater confidence to roll out more. I know there's been some commentary in the media today with regards to a need for more in metropolitan Adelaide. They're coming. The Police Commissioner's got plans to roll out more. I know that there were queries and concerns regarding sites out north, and I can actually confirm that we will be having additional sites out north. And in fact, I think we are in final negotiations with both Playford and Salisbury to set up sites there, certainly before the end of this month, I think in the next 7 to 10 days' time. But my strong advice to people who are out in the north, if they can't come in, go and have the PCR test. This is very accurate. You'll get that speedy result back, and you'll know for sure whether you have that infection. I can tell you yesterday we had a very good day in terms of vaccinations, certainly double what we had on Sunday. In fact, we had 19,269 vaccinations in South Australia. So when we look at that rolling 7-day number for vaccinations in South Australia. That is still at record levels in South Australia. But as I've said before, I'm not satisfied. I would like to see a lot more people being vaccinated in South Australia when their booster is due, turning up. I think we're leading the nation still in terms of those booster shots administered, or certainly thereabouts, and we're obviously opening up significant additional shots for paediatric vaccinations, both down at Wayville and also, of course, with the dedicated clinic at Enfield, which opened up just yesterday. I've also got some very good news regarding staff working within SA Health. We have told you over the last 2 weeks that we have been very concerned about the number of people in SA Health who are COVID positive or are furloughed. I've told you that we try to utilise that workforce as much as possible with our COVID response care team, the cricket team, and they've been working right through, but they do create complexity for us. What I can tell you today is that we've had a further reduction in the number of people both COVID positive and furloughed. In fact, at the moment we've got 558, so 558 COVID positive, down from 271 2 days ago, and the total between COVID positive and furloughed is now down to 778 people in SA Health. Let's not forget, 4 days ago that was 918, pushing up against 1,000. It's now down at 778. There are still very significant workforce shortages right across SA Health, like there is in many sectors in South Australia. I'm not going to sugarcoat it. These are very tough times for our health professionals. I think they're doing an extraordinary job, whether they be our doctors, our nurses, those people administering the vaccinations or pathology, our fabulous ambulance officers in South Australia. Earlier today, I met with their union representatives. It was a positive meeting. I think we moved forward on a number of issues, and we're certainly committed to ongoing negotiations. A lot of the issues that were raised were about transparency of the plan, the capacity plan, where we're going to be in terms of workforce now, 3 months, 6 months, 12 months down the track. So we'll work through all of those issues. I want to thank the union for requesting a meeting. They did that on Sunday. We met this morning. I also, of course, met with the AEU, representing many of the people that are working in the education system in South Australia. They requested a meeting yesterday afternoon. I met with them at 9:15 this morning. They did request that we delay the start of term 1 for 2 weeks. I couldn't accept that request. We've received very detailed advice from SA Health and South Australia Police, and the Education Department with regards to returning students to school. I'm quite sure that the advice that we've received from SA Health and the Education Department are the advice that we need to be listening. It's going to be a disrupted start to term 1. There is no doubt about that. But I do genuinely believe we've got the middle course here in South Australia. Some states going back day one, everybody in together. We received very clear advice that this would create between 20 and 30,000 additional positive cases in the month of February. I am very grateful to all of our teachers, our principals, our school support officers, everybody working within the Education Department in South Australia. They've done an exceptional job over the last 2 years in particular, and I think our students in South Australia have had the very best, fullest education in the entire nation. Many states had their education departments online for months and months and months over the last 2 years. We've had the highest rate of face-to-face learning of any state in the country. With regards to Operation Limit, there were 65 inspections that were carried out yesterday. There was only one found non-compliant, and education was issued. There was no expiation notice that was issued for that. This was a program, Operation Limit, which was going to conclude this week. The Police Commissioner informs me today that this is going to continue for another 2 weeks. So hopefully that gives you a bit of an idea of where we are at the moment with regards to COVID. With regards to our announcement today, the Women's and Children's Hospital has done an outstanding job in the history of South Australia, and in particular during these COVID times over the last 2 years. You know that we were very concerned about children in the early days, whether without vaccination they were going to have higher level symptoms, lower level symptoms. Nobody really knew. We monitored it very carefully. We set up a working group within the COVID Ready Committee that did come along and discuss the issues associated with the disease in younger people, the capacity here at the Women's and Children's Hospital. Still to date, we've not had one child who has gone into the ICU, so that's very good news. But this is a hospital which needs to survive through until when we open the new Women's and Children's Hospital, which of course will be co-located with the Royal Adelaide Hospital in line with that clinical advice that we have received. That's going to be a fantastic new facility, $1.95 billion, but we've got to maintain the standard here at the Women's and Children's Hospital in the interim. And today we have committed and in fact implementing a $30.3 million investment in the ongoing sustainment and upgrade of the Women's and Children's Hospital before we move to the new hospital. This will include a massive upgrade to the adolescent ward here in South Australia, an expansion of the emergency department with another 10 treating spaces. So this takes the total now up to more than $80 million that we have spent or are spending on upgrading the Women's and Children's Hospital ahead of the move to the new site adjacent to the Royal Adelaide Hospital.
In regards to your meeting today with the Education Union, you say that in terms of their demand for the delay of resumption of schooling that you're taking SA health advice, but presumably the advice is just don't send all the children back to school, and in fact it would be safer to delay the start than it is to send half the students back to school on February 2. No,
that wasn't their advice at all. And I've gone through this in a lot of detail in my press conferences, which really focused on this. I'm happy to go through it again, but the very strong advice from SA Health is that every student deserves face-to-face learning. It was going to be impossible from day one, taking into account the advice that we'd received from the modellers. But Nicola Spurrier herself is a paediatrician. She feels very strongly that face-to-face learning is a requirement.
So is SA Health providing...
Well, I'll just finish the sentence. I appreciate you weren't at the previous press conferences, but you've asked a question, and I think it's only right to actually...
I understand the answer. Is the health department providing health advice or education advice?
I think I've answered that question. Andrea?
The Education Union says that its discussions with you were disappointing and unhelpful this morning. Why couldn't you come to the table with something they were asking to try and avert this strike? It looks like they're leaving voting open till Monday, and we could have teachers walking off the job on day one, term one.
Yeah, well, look, obviously I'm keen for teachers to be in their schools at the start of the term. I think this is unequivocally in the best interests of our students. We appreciate this is going to be a very disrupted start to the term. We did point out that there's still further advice that we'll receive from the National Cabinet this Thursday. I still don't think there are other states that have even put their return to school plans in full out. I think Queensland have talked about some delay, but we've probably gone the furthest of all the states ahead of the National Cabinet. We've done that so that we can get more information on the table for our parents, for our students, for our teachers, principals, governing councils. So it is going to be disrupted. We still do need to work through some of the final elements of the return to work plan and the use of rapid antigen tests in some limited circumstances here in South Australia. But look, I thought it was a respectful meeting, but we couldn't agree to the union's request to delay the school year by 2 weeks. We believe that we've got the balance right here in South Australia, and we'll be proceeding with that.
What sort of arrangements are being made if there is a stop work on February 2? Isn't that going to derail the return to school plans anyway?
Well, look, let's wait to see. The ballot is obviously going to go ahead. That's the union's decision. I've got to put the children of South Australia first. Also the teachers and the parents. We've taken all of these things into account. I believe we've got the balance right here in South Australia.
Premier, on Friday, I think you told us that the audit on ventilation in schools had been completed. Then at that point, did you know that was only 50% complete?
Just to be clear, that wasn't even an issue which was raised by the union today. So
Well, this has been raised by the actual head of the Education Department, who's told a webinar that only 50% of the audit has been completed, and he's asked principals to go around and keep doing this audit.
Yeah, so the audit was undertaken by the Department for Education with SA Health having input into that process. It really identified a number of situations that occurred, some rooms which had adequate ventilation, some which previously had adequate ventilation which needed some work to be able to open windows that have been permanently closed, some which had air conditioning. We have a very high proportion of that in South Australia, and then we have a very small number of situations where we may require air purification. We've thought about areas where we will need these, where there may be some interference outside which won't allow that ventilation. But ventilation is definitely the focus of SA Health. I think Nicholas Berry has been very clear on that. And so all I can say is I believe, again, on this one, we've got that balance right.
You are aware it's only 50% complete at this point?
Well, I haven't got that final detail. No, that hasn't come to me. But I know that work has happened and will continue to happen. But once you get a vast proportion through, you can extrapolate very quickly out by site, and of course that will ultimately be the responsibility of the individual schools to make sure that they can put their adaptation to the situation in place, both using their own resources, Ventia's resources, and of course the departments.
It's not concerning to you that half the schools in South Australia don't know if the ventilation is right a couple of weeks out?
No, as I said, you know, doing 50%, 60% survey will give a very clear indication of those proportions. Ultimately, it's over to individual principals, governing councils to make the adequate changes to the curriculum. Obviously, our focus is for students to resume into classrooms where there's good ventilation or air conditioning. In certain limited circumstances, we'll have to use air purification.
Premier, can I just ask you on rat testing sites, there's been some criticisms that there are no sites in particular parts of country, SA, particularly the York Peninsula and the mid-north around Port Pirie. One, what's your response? And two, is there any plans to create such sites there?
Look, there are plans underway at the moment to roll out additional rapid antigen test collection sites. It does require quite a lot of logistics to get this right. It requires a new workforce to be put into place. Don't forget, in most parts of regional South Australia, they have ready access to the PCR test, and this is still the superior test. Let's not forget what we're trying to do with the rapid antigen tests are only put in place to take that pressure off the PCR test. I don't see any real length of people lining up in front of PCR tests at the moment in South Australia, but we will get the rapid antigen test collection sites in place in the coming days. I think we've got a plan to roll out the vast majority of them in the next 7 to 10 days.
Advice to close contacts change? You mentioned there that if they return a positive rat test, you are recommending for them to have a PCR?
No, a negative rat test with symptoms. So say, for example, you get your 2 tests and you have your positive, well then we just take that as a positive. You don't need to have the confirming PCR. If you get a negative rat test, but then you develop symptoms, our strong advice is to go and have a PCR test, because the rat test is not nearly as accurate and sensitive as the PCR. So especially in the very early stages or the later stages of an infection, the rapid antigen test is not as accurate as PCR. So if you've done a rat test, you've got a negative result, but you've developed symptoms, the strong advice is to go and get a PCR test.
Just back on the use of rats in schools. You've just said there that they'll be used in limited circumstances in South Australian schools. We know that other jurisdictions are going to roll them out more broadly. So why not follow that lead? And if you're not going to follow that lead, what circumstances will they be used?
So we haven't fully decided on how we'll use our rapid antigen testing capability within the Education Department and presumably in the independent and Catholic schools in South Australia. We are waiting for the National Cabinet meeting on Thursday. That will receive some advice from the AHPPC. There was a meeting of the AHPPC that Professor Spurrier attended yesterday. There will be further discussions with the AHPPC. Every state's in a different place. I think in South Australia we're at or near that peak, and I hope the numbers continue to come down. I hope we see the numbers in our hospitals stabilise and reduce, especially for those people that are there for reasons associated with their disease, not just because they have another reason and they happen to be COVID positive. So we'll look at all of those, but every state is in a different stage. There are very, very significant, very acute pressures on workforce in some other states at the moment. As I said in my comments earlier, we are starting to see a levelling off of the infections within our critical workforce, the SA Health workforce in South Australia. We'd still love to see it a lot lower, and this puts a lot of pressure on us, but every state's in a different position. So we would really prefer to wait until Thursday when we can give a full explanation, but we tried to get as much information out regarding our return to schools plan as possible last week.
Thursday going to be the day, is that when we're going to see the rest of the plan for the school?
Well, I think it would be Thursday or Friday. Last week I said we'd get the education policy out on Friday. We were able to get a lot of it out after Thursday, but we just really need to see that that final AHPPC advice, I think, until we're in a position to be able to give the best response possible.
Premier, can I just ask you about rats again, please? Some aged care, a lot of aged care providers are hoping to get rats provided to them. They're saying that the Commonwealth hasn't been very receptive to that, to help visitations. Will you look to boost rapid antigen allocations to aged care facilities here in South Australia, even though it is a Commonwealth-run operation?
Look, you're right, it's a Commonwealth obligation or area that they supervise, not the state, but we do have a large number of aged care facilities within the SA Health area, probably the highest proportional in the nation, and so we will be using rapid antigen tests within our own system. Obviously we're going to do everything we can to help the private sector procure those. There was a discussion today at the COVID Ready Committee that some groups would benefit from having some assistance with this, so we're very happy to look at that.
Can you elaborate a bit more?
So basically there are two groups providing aged care in South Australia. You've got SA Health, mainly in the country, well I think exclusively in the country, and then you've got a number of private providers, some of them small, some of them are larger. Some of them have sorted out their procurement and some are struggling, and so obviously it's not our area of responsibility, but it's one that we want to help as much as we possibly can, so we're in discussions with them at the moment about helping them source and secure rapid antigen tests for their workforce and for those visitors that may be potentially coming onto site.
Local government face-to-face meetings will be resuming around now. Are you concerned that there may be a number of holdouts within councils amongst elected members and staff who are not being vaccinated? And would you consider a mandate for that sector?
Well, our strong advice to everybody across the state at the moment is to work from home unless it's absolutely necessary. Now, individual local governments will have to look at the arrangements that they've got in terms of the spacing, the density. We certainly wouldn't want to see any density greater than 1 per 4 square metres in the chamber, but ultimately they need to make that decision. Look, I'm hopeful that very soon we will be able to provide some further advice regarding return to the work environment. At the moment we've asked people to work from home if possible. I've got to say, as inconvenient as Zoom meetings and team meetings were in the early days, I think the vast majority of people now can get their mind around using it, putting up their hand before they're speaking and so on and so forth. So I would caution councils about returning to their practices from before Omicron immediately, but I think that we are at a position where we're going to be gradually heading in that direction.
Can I ask you about this particular announcement here about the extra funding for the Women's and Children's Hospital? You've now spent $80 million
Yes.
on sustainment work. We know that projects of the size and scope of the new Women's and Children's Hospital, they very rarely run on time. Is $80 million going to be enough to keep this site going until North TerraCycle?
Yeah. So just first of all, I wouldn't call it sustainment. In fact, a lot of the projects that we put in place are enhancements. So today, a massive upgrade to the adolescent ward in South Australia, and also an upgrade to the emergency department, providing 10 additional treatment spaces. So that's an expansion over what's there, not just a paint job. Look, we're committing another $30.3 million. This is a great hospital. We don't want to see it go to rack and ruin like the Royal Adelaide Hospital did ahead of the move to the new site. The previous government should hang their head in shame the way they let that facility deteriorate to the detriment of those people that were patients there. By contrast, we've already committed $50 million today, another $30.3 million, more than $80 million going to making sure that we maintain and enhance the fabric of our fabulous women's and children's hospital.
How concerned are you about the number from aged care centres, and has there been a rise even though our daily case numbers have fallen?
Yeah, so I don't have the update for you today, but 2 days ago, the press conference, I went through the number. In fact, I think it was yesterday, went through the number of outbreaks. Now, I've got to remind people that an outbreak is a national definition, which means one resident or two staff. So we have more than 100 residential aged care facilities in South Australia where there is a designated outbreak at the moment. Many of these are reasonably minor and can be easily accommodated. Some of them require SA Health to lean in and offer higher levels of support. And of course, it's outside of our area of responsibility, but it's 100% what we want to be doing, helping people right across the sector at the moment. We are, of course, very concerned about the aged care sector because we've got some of our most vulnerable members of our community who are in those residential aged care facilities, and that's enhanced by the fact that people are living in close proximity. We find, and you would have remembered early in the Omicron wave, we had some very significantly escalating numbers in our prison population in South Australia. Thankfully, that has not only plateaued, but very significantly declined. I've got to say, when we work with the residential aged care facilities in South Australia, we see day after day very high level attention to infection control at a much higher level than existed anywhere in the country 2, 5, 10 years ago. So everybody's acutely aware of the problem. It is a transitioning period at the moment. I said yesterday at the press conference that Professor Nicola Sperry would be updating the return to work plans for aged care. As of the COVID Ready Committee meeting this morning, they hadn't been completed, but my understanding is they will be completed today and shared with the sector tomorrow. This is going to address the primary constraint, which is workforce. So if you want to have more visitors to your site, you want your residents to be out and about, you do need a workforce, and this workforce is under enormous stress and pressure at the moment. This is why I'm very hopeful that we are at that peak or thereabouts at the moment, and that we can start to see the numbers reducing, and that means more people back at work very soon.
Can I just, sorry to keep jumping back and forth with the women's and children's. The 10 paediatric emergency...
Why don't we, the health minister's here, get him to answer the question.
They finally turned up.
No, he was at the Royal Adelaide. Stephen, come over and you can see if you can answer this question. Yes. Yeah, I've got to say I was very impressed with the submission that the Ambulance Employees Association made today. Very respectful. In fact, it was a very respectful meeting with our health unions in South Australia. Of course, they've got concerns. We're not going to sugarcoat it. There are great challenges in place at the moment for workforce here in South Australia and around the country. The ambulance employees in particular raised the issue of workforce. There are more ambulance officers coming on stream at the moment. They advocate that there are many more that are required. We're certainly very happy to look at that. Obviously, they're under enormous pressure and strain at the moment because there are a number of ambulance officers that are in a situation where they cannot go to work, either because they're COVID positive or close contacts. One of the things that we did discuss today, we did benchmark what other states are doing with an education advertising campaign around using the 000 number. And so this was supported by the union interstate. It would be supported by the union here in South Australia, just educating people about the reasons why you would call 000. So that's something we're going to fast track now and get onto as quickly as possible. I thought today was a useful meeting. We ran well over time, but we also ran well out of time, so we'll be scheduling other meetings in the near future.
Well, the unions did welcome the discussions with you after 3 years. They said they haven't had face-to-face discussions with you. They also said that they left with nothing, with no extra resources promised. And the actually get the staff, the preparations needed to happen years ago, or at least 12 months ago.
Well, Andrea, well,
Staff ones, do they even exist?
yeah, so it's a good question, but Andrea, look, let's be clear, there were more than 1,000 health professionals put on last financial year. So to suggest that no planning had been done, I mean, it's been a major ramp up, and I'm happy to provide those for you. Obviously, workforce is under enormous pressure. The issues that were raised, and by the way, with these unions sent forward before the meeting was held, were issues that were all covered, as well as many other issues, and we'll look at each and every one of them. But we're looking at all and every opportunity to increase our workforce at the moment. We've been doing that since we came to government. The independent Auditor General's observation in terms of health workforce will be able to clearly show the increases under the government. When we came to government, the health budget was $5.8 billion per year. It's 7.4 at the moment. So this planning has been in place for a long period of time. Sorry?
But is that a problem at the moment where you sort of put on extra beds? Do you weigh that up against the staff? Is that a struggle?
Well, it's one of the reasons why in South Australia we did have to cancel non-urgent elective surgery, which I note now I think most other states have followed. We do that because workforce around the country is under enormous pressure. We perceive this as part of our planning, so we put that in place. We've had a cooperative relationship with our private hospitals in South Australia. We've signed an agreement with them to transfer non-COVID patients into those private hospitals and also use their workforce. And their workforce is not just used with the patients transferred from the public to the private hospitals, but also as part of our work in terms of vaccination.
Premier, can I ask you about a story broken a short time ago by my colleague Tom Richardson here about pre-selection for the seat of Narunga? Why did you wait, or why did the party wait until now to open pre-selection for that particular holiday?
Well, you'd have to direct that to the state director, Sasha Meldrum. So there was a state executive meeting which was held last night. Unfortunately, I couldn't be there at the time. I think Rob Lucas attended. He mainly attends when I can't attend those state executive meetings. A decision was made to open the pre-selection for Narunga.
Frank, can I just ask you again on work from home? The City Council is working on strategies to get people, especially office workers such as public servants, back into the city. Are you able to say when people might be able to return from home back to the city so they can start spending money on struggling businesses that are lots in the city?
So I yesterday met with the Adelaide City Council, so the Mayor and the elected members and key people within her team, Zoom meeting of course, and we did discuss the return to work arrangements. They're very keen for that to happen as soon as possible. We're obviously seeking health advice. I think we'll be in a position in the coming days to announce what that return to work will be. I'm hopeful that certainly by the end of the month we can start that staggered return to work, but there will be issues around density in workplaces. We want to make sure that this is going to support our businesses, particularly in the CBD, but we also want to make sure that it's safe for those who are returning to work. So the current arrangement to work from home, unless this is impossible, is still in place, but I'm hopeful in the coming days to be able to provide a further update.
Are anticipating a mask mandate in workplaces?
So we'll give a comprehensive statement with regards to masks, with regards to density, with regards to vaccination status, and also time frame in the coming days. We just sort of want to see a little bit more information that comes in. We are hopeful to get a further update to our model this week, maybe Thursday, maybe Friday, from Professor Ross from the University of Adelaide. He's done some fantastic work. I don't think he had much of a Christmas holiday, so we're very grateful for the work that he's done. But look, people have got legitimate questions, queries and concerns about return to work, and we hope to be able to answer those questions in the coming 24, 48 hours. Yes.
What's your view on Mr. Ellis potentially running as an independent in that seat, and is that going to make it hard for the Liberal Party to retain?
Well, look, I think that it's important for the Liberal Party to run a candidate in each of our seats. That's certainly the feeling of the state executive, and they acted upon that last night. Now, for what Fraser Ellis does is certainly up to him. I think he's given every indication that he'll be running as an independent.
Will you start seeing some campaign material from you soon? And when can we expect the official campaign to begin from your point of view?
Look, the reality is that my focus at the moment is 100% on this Omicron wave. I know that we have an election in 60 days, but actually my focus every day between now and the election, and hopefully every day after the election, is going to be on keeping South Australia safe and recovering our economy as quickly as possible.
Just ask you briefly, Premier, on the circumstances down at the Abattoir.
Yes.
Our report. I understand some of the workers down there that feel a bit disappointed by the whole situation played out, that SA Health could have done more to protect them, potentially from having to work in that particular environment where people work on COVID positive. Could lessons have been learned from what happened down there, and did you handle things differently next time?
Well, look, I'll be honest, I'm not familiar with the specific grievance that you've just put to me, but what I can say is after any outbreak, any response by SA Health, we obviously sit down, review it, make sure that we can learn from it. So I think we can learn from every single activity with regards to this Omicron outbreak. It's still very new. The world is learning about it, and so other jurisdictions, when they learn things, share it via the AHPPC or the Health Ministers meeting or the National Cabinet. We should be doing exactly the same.
Well, you're saying you're not going to campaign. You're saying there's an election in 60 days, but you're just 100% focused for that whole period on the Omicron situation. So you're not going to campaign. We won't see election material.
Oh, look, my priority is definitely on keeping South Australia safe during this. This is preoccupied every waking moment, really, for the last sort of month or so. I had these grand plans of having a few days off over Christmas. We've had a COVID-ready committee meeting every single day, whether it be Christmas Eve, Christmas Day, Boxing Day, New Year's Eve, every single day, Saturdays and Sundays, and I've been supported very well by all of the members on that COVID-ready committee. There are very few absences whatsoever for any reasons other than other work meetings, and so the whole team is very much focused on this.
Premier, can I just again ask you about the women's and children's?
Yes.
I appreciate the help you here now. You mentioned 10 paediatric emergency department spots.
Yep.
According to the document that you've given us, the press release, it says it's going to replace the 9
temporary ones. Yeah.
So is that actually one extra place, or is it 10 extra places?
Well, don't forget the 9 places are really only a temporary arrangement. They cannot stay there permanently. This hospital was designed for a certain capacity, and we've now identified that we need to significantly increase that. So another 10 permanent, emergency department treatment spaces will be put into place here.
In today's announcements, we've added another $30.3 million in capital funding to the $50 million we've already put into the current Women's and Children's Hospital, so we can continue to maintain a world-class facility while we're building an even better facility on North Terrace. This is a capital investment, not a staffing investment.
Could you talk us through the consultation recently with staff that the Women's and Children's Network CEO says is now going to be considered? Are you looking to redesign the plans because you've had some any feedback to improve the design?
As the Premier said, this government is not going to commit the sin that the former government committed in terms of building a hospital without engaging clinicians. So right through this process, we've actively engaged clinicians. The consultation process that the Chief Executive was referring to was in relation to the placement of services within the tower block within the new Women's and Children's Hospital. A number of options were put out to the clinicians and our wider Women's and Children's Hospital community. My understanding is that as part of the consultation, even further options were added to the consultation process. So the Women's and Children's Hospital project team is now going through that feedback. particularly to see what is the best configuration of services within the new building.
Is there any early indication that let's put it this way, with those potential changes to the design, is that within the existing project timeline, or is there going to be an impact on that because you've gone back again to make further changes?
My understanding is that the key issues or the key options were about the placement of surgical and emergency department facilities. If you like, what's the best place for related facilities? My understanding is that none of them involved a change to the overall profile of the building. All of it was to be done within the building.
What is that? Sorry, what does that mean?
That means that one option might have had a facility on one floor, another option had a facility, a particular service on another floor.
But that's still a work in progress, though, really, because that, from my recollection, that was a 3-week consultation process which was meant to wind up in early December. We're now mid-January.
Yes,
so it's still in a state of flux.
Well, certainly we show respect to the people we consult by actually digesting what feedback they give us. In terms of the overall program for the Women's and Children's Hospital consultation, we are extending the timeframes in the context of COVID. We have a significant Omicron wave, which is impacting obviously on the Women's and Children's Hospital community. As we stand here, there are 6 young children in this hospital who are COVID positive. So our priority has got to be delivering services to those children and children right around the state. There'll be a slight delay in the consultation.
Just because a net increase of 1 ED.
I think it's really important to appreciate that the pods that were put onto Sir Edmund Smith Drive were shall we say, an emergency measure in the context of COVID. In fact, they were funded by the Commonwealth Government specifically as an early COVID initiative. So they've been in that position since early 2020. They weren't designed fit for purpose. What we're delivering is a 10 treatment bay paediatric emergency department, which will be fit for purpose. I think it's also important to appreciate that this government and this local health network is rapidly embracing virtual technology. So in August last year, we launched a virtual urgent care service so that children and adolescents could get their care through a telelink. Since that initiative was launched in August last year, 1,300 children and adolescents have received the care that they need from the comfort and safety of their own home. That avoids unnecessary deployment of ambulances. It certainly saves the family the trauma of a hospital, a trip to hospital and possibly a wait at the hospital, and it's certainly easing pressure on, shall we say, the non-virtual emergency department. So the 10-bed paediatric emergency department that will be part of this $30.3 million investment are just another further investment in emergency services in this network.
Is this money funded in the mid-year budget review, or is it new money, in other words, an election commitment?
I'm sorry, that's a question I'll need to ask the Treasurer. I can't remember which statement it was in.
I can.
So this is money that wasn't included in the mid-year budget review, but goes through the normal budget process. So out of the normal budgetary process, it goes through the Budget Cabinet Committee. So this is committed money, which now goes in as an adjustment to the budget. Okay, thank you.